mesoderm gives rise to all of the following structure in the fully developed fetus. Accept the answer. We'll see one by one. Muscular system, nervous system, circulatory system. So answer is 4, that is gonads. The next question. Which one is produced by mesoderm? Heart and notochord, heart and brain, spinal cord, notochord, brain and notochord. The answer is first one, heart and notochords. Next one. In 28 days human ovarian cycle, ovulation occur on the first day, 5th day, 14th day and 28 days. The answer is 3, on 14 days. Next one. Part of sperm involved in the penetrating egg membrane is, that is tail, acrosome, allosomes, autosome. The answer is 2, that is acrosomes. Next one. During phototherapy, the nurse should apply eye patches to the newborn's eyes too. We have to apply. Answer is 3. Prevent injury to the conjunctiva and retina. Next one. A client is admitted to the hospital in active labor. After a amniotomy, the nurse should accept the answer. Increase fetal heart rate. That is the answer. Answer is 1. Next one. Corpus luteum developed from A. 1 oocyte, B. nephrostomes, Graafian follicles. None of these option. The answer is 3, that is developed from Graafian follicles. Next one. Corpus luteum secretes which hormone? LH, estrogen, progesterone and FSH. The answer is 3, that is secrete progesterone hormone. Next one. 59. Preparation of sperm before penetrating ovum is, that is called, answer is 4th, capacitation. Next one. Fertilized ovum is implanted in uterus after, that is answer is 7 days. Next one. The nurse anticipated initial treatment of adolescents with anorexia nervosa. That is answer is 4th, correction of electrolyte imbalance. Next one. 62. A child has cystic fibrosis. The nurse should evaluate that the parents understand the dietary for their child when they say they will. The answer is 3rd one, provide high caloric food between meals. The next one is 63. When assessing a child with chronic hypoxia, the nurse should monitor for, that is answer is 1, clubbing of fingers. That is the answer. Next one. The nurse teaches the parents of child with fever, headache and stiff neck that the test used to confirm the diagnosis of meningitis in a child is A. 1 blood cultures, B. lumbar punctures, C. meningomyogram and 4 one is peripheral skin smear. The answer is 2, that is lumbar puncture. Next one. 65. The nurse is caring for a child with a very low platelet count related to chemotherapy. The nurse should monitor this child urine for the presence of A. protein, B. glucose, 3 erythrocytes and 4th one is lymphocytes. So answer is 3, that is erythrocytes. The next one. After receiving immunization for diphtheria, tetanus and pertussis, a child develops swelling and tenderness at the injection site, low-grade fever and malaise. The pediatric nurse informed the child's parents that. The answer is 3rd one. This is a mild reaction and teaches how to manage it. The next one, 67. After 1 hour after birth, the nurse should expect a neonate to be a crying and cranky to hyper responsive to stimuli. 3. Relaxed and sleeping quietly. 4th one, intensely altered with eye wide open. So answer is third, relaxed and sleeping quietly. Next one, 68. A 4.5-year-old child is brought to the emergency department with a fractured tibia. The nurse knows that the children of this age, the most frequent encountered type of fracture is classified as A. green stick fractures, B. transverse compound, and 4th one is communicated. That is, in children, that is called green stick fractures. Next one, which behavior should the nurse recognize as the motor reflex response? The answer, before abduction, then after adduction of the arm. The next one, with 3 minutes after the birth, the heart rate of healthy alert neonate may range between A. 120-180 beats per minute, B. 130-170 beats per minute, 110-160 beats per minute, and 100-130 beats per minute. So answer is third one, that is 110-160 beats per minute. The next one, a 10 hours of age, an infant has a large amount of mucus and becomes cyanotic. What should the nurse do first? A. suction, then B. we have to give oxygen, third one, record the incidence and insert angiotube. So answer is 1, we have to do suction. Next one, 72. A newborn has a small whitish pinpoint spot over the nose, which the nurse knows are caused by retained sebaceous secretion. When charting this observation, the nurse identified it has 1. Melia, Lenugo, whiteheads, then Mongolian spots. The answer is 1, that is Melia. Next one, what type of immunity is transferred to the fetus through the placenta? There is passive natural immunity. Next one, closure of newborn's foramens ovale is caused by, the answer is third one, an increase in the pulmonary blood flow, that is cause closure of foramen ovale. Next one, 75. After the birth of a healthy neonate, the ductus arteriosus become the answer is 4th one, ligamentum arteriosum, that is called. Next one, 76. What is the primary critical observation for Apgar scores? That is heart rate. Next one, the nurse should explain to the client that breastfeeding is always contraindicated with A. mastitis, hepatitis C, inverted nipples, and herpes genitalia. The answer is 1, that is mastitis. The next one, a newborn is diagnosed as having a palsy. The nurse is aware that this problem is caused by A. disease acquired in utero, B. X-linked inherited patterns, the third one, a tumor arising from muscle tissue, the fourth one is an injury to the brachial plexus during the birth. That is, the answer is fourth one. The next one, during a vaccination drives at a well baby clinic, a nurse observed that a recently hired nurse is not wearing gloves the nurse should advise the newly hired nurses to? The answer is second one, put on gloves because standard precautions are required. Next one we'll see, that is 80. Play during infancy is most important because it enhances social development, physical development, cognitive development, and fourth one is emotional development. So answer is 2, that is physical development. Next 81. The bacillus that cause plague is called, that is Yersinia pestis. The next one, immediate treatment of dog bite is sent to the hospital, application of antiseptic, wash the wound with soap and water, and suturing. The answer is third one, we have to wash the wound with soap and water. The next we'll see, the stools of cholera are, that is in green in color, yellow, rice water, and normal. The answer is third one, that is rice water. Next one, rabies is transmitted by the bite of, the answer is fourth one, a rabid dog. Next one, important objectives of health service are prevention of disease, promotion of health, cure from the disease. The answer is fourth one, all of the other option, that is important objective of health services. So next questions we will discuss in next video. So you subscribe, like and share. Those are new subscribe, please subscribe. Thank you so much.